Imagine waking up one day with just a mild stomach ache. You brush it off as something you ate, maybe just indigestion. Days go by and suddenly your bowel habits change. You're either constipated for days or rushing to the bathroom unexpectedly. It's uncomfortable but nothing to worry about, right? But what if these small changes were your body's way of warning you about something far more serious? Bowel cancer, also known as colorectal cancer, is one of the most commonly diagnosed cancers worldwide. In the United States alone, over 150,000 people are diagnosed each year, and yet many cases go unnoticed until it's too late. Why? Because the early warning signs are often ignored or mistaken for minor digestive issues. Today, we're breaking the silence on this hidden killer and exposing the 9 early warning signs of bowel cancer that you should never ignore. At the end of this video, you'll also learn how to protect your gut health and the lifestyle changes that could save your life. So stick with us. This might be the most important health advice you'll ever hear. Let's dive in. Unexplained changes in bowel habits. Do you find yourself constipated one week and having diarrhea the next? Have your bowel movements changed without any clear reason? Warning signs to watch for: frequent constipation or diarrhea. Thin pencil-like stools, a possible sign of a tumor narrowing the colon. Feeling like you can't completely empty your bowels. Why it happens. Bowel cancer can disrupt normal digestion by causing blockages or irritation in the intestines. This leads to erratic bowel movements, often dismissed as just something I ate. When to see a doctor. If your bowel habits change suddenly and last more than 2 weeks, it's time to get checked. Blood in your stool, a major red flag. One of the most ignored yet alarming symptoms of bowel cancer is blood in your stool. Many people mistake this for hemorrhoids, but the truth is, blood in your stool is never normal. Signs to watch for: bright red blood on toilet paper, dark tar-like stool indicating internal bleeding, small clots or streaks of blood in your poop. Why it happens. Tumors in the colon or rectum can cause bleeding as they grow. This blood mixes with stool, making it hard to detect without careful observation. When to see a doctor. If you notice blood in your stool more than once, it's time to see a specialist. Chronic abdominal pain and cramps. Occasional stomach pain is normal, but persistent unexplained cramps or bloating. That's a different story. Signs to watch for: frequent, dull aches in the lower abdomen. Cramps that don't go away even after using the bathroom. Pain that worsens after eating. Why it happens. A growing tumor can obstruct normal digestion, causing pain, gas buildup, and inflammation. This pain is often misdiagnosed as IBS, irritable bowel syndrome, or gas. When to see a doctor. If your stomach pain persists for weeks, get it checked immediately. Unexplained weight loss. Losing weight without trying. That's a serious red flag. Signs to watch for: losing more than 10 pounds without dieting or exercising, sudden loss of appetite, and feeling full after eating very little. Why it happens. Cancer cells use up your body's energy, speeding up unintended weight loss. A growing tumor can also block nutrient absorption, leading to malnutrition. When to see a doctor. If you're losing weight without explanation, don't ignore it. Constant fatigue and weakness. Signs to watch for: always feeling exhausted, even after sleeping well, struggling with daily activities due to weakness, and feeling lightheaded or dizzy frequently. Why it happens. Internal bleeding from a tumor leads to anemia, which causes fatigue and weakness. If you're constantly tired and can't pinpoint why, it's time to investigate. When to see a doctor. If your fatigue is ongoing and unexplained, seek medical advice. Feeling bloated all the time. Signs to watch for: frequent bloating that doesn't go away, feeling like your belly is unusually full or swollen, and discomfort even after small meals. Why it happens. A growing tumor can block the intestines, leading to gas buildup, bloating, and stomach pain. When to see a doctor. If bloating persists for more than a few weeks, get it checked. Frequent nausea and vomiting can be a sign of bowel cancer. Here are some signs to watch for. Feeling nauseous often, even without food poisoning, vomiting for no clear reason, and a constant upset stomach. This happens because a bowel obstruction caused by cancer can lead to digestive issues, nausea, and even vomiting. If nausea and vomiting are frequent, it's a serious warning sign, and you should see a doctor. Feeling a lump in your stomach or rectum is another potential sign. Look out for a firm lump in the abdomen, a hard spot near the rectum, and pain or tenderness when pressing the area. This occurs because a tumor grows and becomes noticeable as it enlarges. If you feel an unusual lump, don't delay a checkup. Unexplained anemia is a silent but serious warning sign. Watch for pale or sallow skin, dizziness and frequent headaches, shortness of breath, constant fatigue and extreme weakness, cold hands and feet, brittle nails and hair loss, and a rapid heartbeat and chest discomfort. Bowel cancer often causes slow internal bleeding that can go unnoticed for months. Small amounts of blood leak from the tumor into the intestines over time, and your body struggles to replace lost red blood cells fast enough. Without enough oxygen-rich blood, you start feeling exhausted, weak, and out of breath. Many people don't connect anemia with bowel cancer because they don't see obvious blood in their stool, making it one of the most overlooked early signs. If you've been diagnosed with iron deficiency anemia but don't have a clear reason, like heavy periods, pregnancy, or a poor diet, you need further testing. Ask your doctor for a stool test for hidden blood, a colonoscopy, and additional blood tests to assess overall health and determine if there's chronic bleeding. Do not ignore unexplained anemia. In many cases, it's the first sign of an internal problem, and that problem could be bowel cancer. Don't ignore these symptoms. Bowel cancer isn't just a disease of the elderly. It's increasingly affecting younger adults due to poor diets, sedentary lifestyles, and lack of awareness. The good news? It's one of the most preventable cancers. With early detection and lifestyle changes, you can significantly reduce your risk. What can you do today? Schedule a checkup if you notice these symptoms. Don't wait. Early detection saves lives. Get a colonoscopy if you're over 45 or earlier if you have a family history. Eat more fiber-rich foods like leafy greens, beans, berries, and whole grains. A high-fiber diet flushes out toxins and keeps your colon healthy. Limit processed meats like bacon, sausages, and deli meats. These have been linked to a higher risk of colorectal cancer. Exercise regularly. Staying active keeps your digestion moving and reduces inflammation in your gut. Stay hydrated. Drinking plenty of water prevents constipation and helps maintain a healthy gut. Take control of your health. Bowel cancer is highly treatable if caught early, but the key is paying attention to the warning signs and taking action now. If you found this information helpful, hit the like button and share this video. It could save someone's life. Subscribe for more life-saving health tips. Stay informed, stay healthy, and take care of your gut.